Cialis or Viagra, the Beatles or Rolling Stones, Coca-Cola or Pepsi, some debates seem like they will never end, and for me, the one between Cialis and Viagra is definitely among them. I know you're wondering. So which one will the doctor actually choose? Oh, hold on, it's not time to reveal that just yet. I'm Dr. Samuel Grant, a urologist and specialist in men's sexual health. In today's video, I'm going to share with you the erectile dysfunction medication I personally value the most, and the reason behind that choice. Not only will we talk about Cialis and Viagra, we'll also explore two other names, Levitra and Stendra. And especially at the end of this video, I'll reveal a simple but incredibly important tip, something that most men completely overlook, which prevents the medication from working as expected. Trust me, you won't see this coming. Oh, and before we begin, I'd love to get to know you, the person watching this video. What's your name? Where in the world are you watching from? It would truly make me happy to know who I'm walking alongside in today's journey. Feel free to drop a comment down below. And if you find this topic helpful, don't forget to subscribe to the channel and turn on the notification bell so you won't miss any upcoming videos. If you have any questions or concerns related to men's health, leave them in the comments. I'll collect and create a dedicated video to answer them for you. Now, let's begin with the most common misunderstandings about ED medications and the reason why so many men still struggle to see results. Part 1's The Untold Truth About Erection Pills. Stop misunderstanding them. Before we dive into comparing each specific medication, I want to help you clarify one very important thing. One of the most common misconceptions that many men fall into. Erection pills do not create an erection automatically. To put it simply, you can't just take a pill and expect to get hard anytime, anywhere, without any kind of sexual stimulation. The medication only works if your body is already emotionally engaged and you're genuinely aroused. Many men feel disappointed when they don't see results after taking the pill. But if you look closer, the issue isn't with the quality of the medication, it's with misguided expectations and incorrect usage. Biologically speaking, these medications, known as PDE5 inhibitors, work by blocking an enzyme that would otherwise end the erection process too soon. When this enzyme is inhibited, blood flow to the penis is maintained longer, helping you achieve and sustain an erection when the right kind of stimulation is present. However, if you take the pill without any arousal or just for the sake of it, then chances are nothing will happen at all. Some people mistakenly believe these pills can trigger sudden, uncontrollable erections in public or cause overwhelming excitement, but that's completely false. In fact, medications that can lead to excessive arousal typically belong to an entirely different class, such as those used to treat Parkinson's disease, and they have nothing to do with ED medications. Understanding the true nature of these drugs is the first step to using them safely and effectively, and avoiding unrealistic expectations that only led to disappointment. So, among the available options on the market, which medication is truly right for you based on its duration, cost, and compatibility with your daily routine? The answer is coming up in the next section. My friend, if you're still watching this video at this point, I'm truly glad to see that you're taking your health seriously. Please leave a number 1 in the comments below to let me know you're still here with me. Part 2, a detailed comparison between Cialis and Viagra. The difference is more than just the name. If you didn't know, Viagra and Cialis are actually brand names. Their active ingredients are sildenafil and tadalafil, respectively, and you can easily find them as generic medications at a much lower cost, while still maintaining equivalent effectiveness. Both belong to the group of PDE5 inhibitors, working through the same mechanism that increases blood flow to the penis. But the first noticeable difference lies in how long they last. Viagra, or sildenafil, is considered a short-acting medication. Typically, its effects last around 4 to 6 hours. Cialis, or tadalafil, on the other hand, is known for its longer duration, lasting up to 36 hours in some users. However, for most people, the average duration ranges from 12 to 24 hours, depending on individual physiology. Another point to keep in mind is how food affects absorption. Viagra is often affected if taken after a high-fat meal, for example, a rich dinner with fried or greasy dishes. This may reduce how well the drug is absorbed and therefore its effectiveness. In contrast, Cialis is less affected by food, making it more flexible in terms of timing. As for side effects, both medications may cause mild symptoms such as headaches, nasal congestion, facial flushing, or acid reflux. However, one distinctive side effect of Cialis is the potential for lower back pain in a small percentage of users. While not dangerous, it can be uncomfortable for some if used regularly over time. In summary, Viagra sildenafil is short-acting, low-cost, but sensitive to food intake. Meanwhile, Cialis tadalafil offers longer duration, more consistent absorption, but may cause back pain in some cases. However, comparing medications on paper is one thing. Choosing the right one in real life depends on your treatment goals, how often you're sexually active, and your personal lifestyle. In the next section, I'll share the medication I most often recommend to my patients, and why I consider it the Swiss Army knife of ED treatment. Part 3. The doctor's personal choice, why I trust tadalafil. Both Cialis and Viagra are highly effective in treating erectile dysfunction. But if I had to choose just one medication to accompany my patients long-term, I would go with tadalafil, in other words, the generic version of Cialis. The reason is that it offers maximum flexibility, especially for those who don't want to feel dependent on having to plan ahead every time they get intimate. Unlike Viagra, which typically lasts only a few hours, tadalafil can maintain its effects long enough for users to feel confident throughout the entire day, and sometimes even into the next. Thanks to this extended duration, tadalafil can also be taken as a low daily dose, rather than just before sexual activity. With this approach, many men have told me they feel much more relaxed, no more pressure or dependency on a specific pill timing. In addition, tadalafil offers some lesser-known additional benefits. One of them is its ability to help improve premature ejaculation when it occurs alongside erectile dysfunction. It can also relieve urinary symptoms associated with prostate enlargement, such as nighttime urination, urgency, or incomplete bladder emptying. And notably, in some healthcare systems like the one I work in, if tadalafil is prescribed for prostate-related issues, the cost may be covered by health insurance. Thanks to these versatile benefits, tadalafil isn't just an ED medication, it's a more comprehensive support tool for the overall health of middle-aged men. That said, tadalafil isn't always the only solution. There are still other options on the market that may not be as well known, but offer unique advantages, especially when the more common choices aren't giving the expected results. In the next section, I'll introduce you to Levitra and Stendra, two names that could become the backup plan for many men. If you're still watching this video at this point, thank you for sticking with me until now. I truly appreciate it. Please leave a number 3 in the comments below to let me know I'm not talking to myself. Part 4. Lesser-known alternatives, what makes Levitra and Stendra stand out? Besides the well-known names Viagra and Cialis, there are a few other medications in the same group of PDE5 inhibitors that are less frequently mentioned, but absolutely worth considering, especially in cases where the more common options aren't producing good results. Levitra, with the active ingredient vardenafil, is one of the drugs introduced after Viagra and is available in generic form. In terms of duration and effectiveness, it's quite similar to sildenafil. However, there's one valuable difference. It's less affected by high-fat meals. This gives users more flexibility, especially if they find it difficult to avoid or control their food intake before taking the medication. That said, one thing to keep in mind is that Levitra tends to be more expensive than other generics. So I usually only recommend it when patients have tried other options without seeing significant improvement. Another option is Stendra, with the active ingredient avanafil, considered the newest member of this medication group. Stendra's biggest advantage is its very fast onset, sometimes as quick as 15 minutes. This might sound ideal for those who need a rapid response. However, the duration of effect is relatively short, quite similar to Viagra or Levitra, and the cost is among the highest of all current options. For this reason, I rarely prescribe Stendra in clinical practice unless the patient specifically needs the quick onset and doesn't mind the cost. There's one very important thing to remember. Although all of these medications share the same mechanism of action, each person may respond differently. Some don't get results with Viagra, but do respond well to tadalafil or vardenafil. So if one medication doesn't work for you, don't give up too soon. Simply switching to another drug in the same class might be the simple yet effective solution you need. However, there's one undeniable reality. Up to 30–35% of men don't respond to any PDE5 inhibitor at all. So what causes this? And more importantly, how can these men still have a chance to improve their sexual function? Let's uncover the answer in the next section. Part 5. When medication doesn't work, where does the real problem lie? Although PDE5 inhibitors are considered a major breakthrough in treating erectile dysfunction, the reality is that around 30 to 35% of men see no improvement after using them. However, instead of rushing to conclude that the medication is ineffective or not suitable, we need to look deeper into how it's being used and into each person's individual health condition. There are several common reasons why the medication may not take effect. The first is an insufficient dosage. Out of fear of side effects, some people start with a low dose, and as a result, the drug isn't strong enough to produce the desired effect. In contrast, starting with the maximum initial dose is often a reasonable way to evaluate how your body responds. Another reason is lack of patience. Many users take the pill but don't wait long enough for it to start working, which leads them to believe the drug doesn't work. On top of that, some people still believe that the medication can automatically trigger an erection without any stimulation, a misunderstanding we've already cleared up in the previous section. If you've taken the right dose, waited long enough, and were clearly aroused but still saw no change, then the cause may lie in underlying health conditions. For example, men with diabetes often respond poorly to these medications due to nerve and blood vessel damage. Severe cardiovascular disease can create similar obstacles. Additionally, pelvic damage from surgery, radiation, or penile tissue fibrosis can reduce the body's responsiveness to the medication. Finally, don't overlook psychological factors or other medications you might be taking. Erectile dysfunction caused by psychological issues often doesn't respond well to PDE5 inhibitors. And some medications, especially beta blockers used to treat high blood pressure, may also impair erectile function. So instead of focusing solely on whether the drug is working, the more important step is to identify the actual cause of your erectile dysfunction. The fact that the medication didn't work isn't the end of the road. It's a sign that your overall health condition needs closer examination. Now, if you've tried multiple medications and still haven't seen improvement, what alternative solutions might actually bring results? In the next section, I'll walk you through non-drug options, from mechanical approaches to regenerative interventions, designed for those who haven't yet found a clear path forward in their treatment journey. Part 6. When medication is no longer an option, effective alternative treatments worth considering. If you've already tried multiple PDE5 medications, using the proper dosage, allowing enough time, and combining them with the right kind of stimulation, but still see no results, that doesn't mean you're out of options. In fact, there are many alternative treatments that have been proven effective, even in cases considered medication-resistant. One of the first options is the vacuum erection device, a simple tool that uses pressure to draw blood into the penis, creating a temporary erection. Although many men feel hesitant or unnatural about using this method, its real-world effectiveness has already been well established. Another highly effective option is intracavernosal injection therapy, where medication is injected directly into the erectile tissue of the penis. When done with proper instruction and technique, this method can bring excellent results. However, using a needle in such a sensitive area requires mental readiness and strict adherence to the doctor's guidance. In more severe cases, especially when mechanical damage or serious underlying conditions have led to a total loss of erectile function, penile prosthesis surgery may be the final solution. This surgical approach helps restore sexual function with a high level of reliability. As for myself, I also specialize in regenerative therapies, including low-intensity shockwave therapy, PRP, also known as the P-shot, and EMT technology. Each method has its own application standards, but they all follow the same core principle: the right treatment for the right patient at the right time. However, before committing to any intensive regenerative protocol, there's one big question that many people wonder about but often overlook. Are erectile dysfunction medications truly safe for the heart? The answer lies in the final part of this video, and I believe it's something you'll want to hear before making any long-term decisions. Part 7. Are erectile dysfunction medications safe for the heart? A question everyone should know the answer to. Before you wrap up your journey in learning about erectile dysfunction medications, there's one extremely important question, often overlooked, that needs to be addressed. Do PDE5 inhibitors, like Viagra, Cialis, Levitra, or Stendra, have any impact on heart health? This concern is absolutely valid since these medications affect the vascular system, and that naturally raises worries about cardiovascular risks with long-term use. In reality, most studies have shown that PDE5 inhibitors do not increase the risk of heart attacks or strokes in healthy individuals. On the contrary, in some cases, particularly in patients with stable cardiovascular disease, these medications may actually improve blood circulation and support endothelial function, which plays a vital role in both sexual health and cardiovascular health. However, this doesn't mean that anyone can freely use these medications without medical supervision. For those who are taking nitrate-based drugs for chest pain, such as nitroglycerin, using PDE5 inhibitors at the same time can cause dangerous drops in blood pressure. This is an absolute contraindication and requires a thorough medical assessment before any use. Additionally, if you have a history of serious heart conditions, uncontrolled arrhythmias, or have recently recovered from a heart attack, the use of erectile dysfunction medication must be carefully evaluated and should not be taken without proper medical advice, even at low doses. In summary, PDE5 inhibitors are generally safe for the heart when used appropriately and without clear contraindications. Understanding your own health status and working together with a qualified specialist is the key not only to improving your sex life, but also to protecting your long-term overall health. And this is something I always emphasize to my patients. Sexual health cannot be separated from general health. Using the right treatment at the right dose at the right time, that is the key to living well and living proactively. My dear friend, we've just walked through a complete and clear journey surrounding erectile dysfunction medications. From the well-known names like Viagra and Cialis to the less commonly discussed options like Levitra and Stendra. I've also shared with you the reasons why these medications may not be effective for some, and most importantly, the alternative solutions for those still searching for the right path forward. The most important thing I want you to take away from this video isn't the name of a specific drug, it's the correct and complete understanding of your own body. There is no one-size-fits-all answer, only the option that suits you best at the right moment in your life. If you still have any concerns about sexual health, urinary health, or any aspect related to the quality of life of middle-aged men, feel free to leave a comment below. I'll collect your questions and start planning in-depth videos to walk this journey with you. Thank you for staying with me all the way to the end. Don't forget to subscribe, turn on the notification bell, and if you found today's content helpful, share it with your loved ones or friends. You might just help someone find the solution they've been looking for. See you in the next video, where we'll continue exploring the most practical and meaningful topics in men's health, in a scientific, realistic, and compassionate way.